So hi, I'm Karen Helfrich with Avalon Psychotherapy Associates, and I am welcoming Krista Verrastro. Verrastro? Verrastro today, who is an amazing drama therapist, and so we are going to be talking about all kinds of things having to do with therapy and mental health and the awesome stuff we do. And I do want to talk up Krista just for a minute because she does these awesome workshops of, and I'm blanking on what we call them.
Vision board workshops.
Vision board workshops. But what I will tell anybody who's local, who is interested in this kind of thing, is that Krista's workshops add drama therapy elements into the experience. And as someone who feels a little anxious and nervous about taking a risk and doing that kind of thing, it was awesome and fun, and Krista helped me feel really comfortable, and I got a lot out of the experience. So I just want to talk you up about that. But yeah, so please introduce yourself and a little bit about what you do.
Sure. So I am Krista Verrastro, and I am a private practice therapist in Reisterstown, Maryland. I have been a drama therapist since I was a teenager, essentially. I found it young. I've been passionate about it ever since. It is very unique. My path has been very unique, but I love what I do, and it shows. I have a lot of enthusiasm for it. So yeah, my specialty as a therapist is trauma work, especially abuse-related trauma. And yeah, not that I don't do the usual things a lot of us therapists do, depression, anxiety, and the likes, but trauma has been my specialty for a while. I worked in domestic violence agency, sexual assault work agency for about 8 years. So that became the longest I was anywhere, sort of became my niche.
Yeah, great. So one of the things that I get really excited about as a therapist is everything that is experiential therapy. And I think that this is something that is growing from, weird outlier alternative stuff to more mainstream, especially as we're learning so much more about how the brain works. And so I'm a big fan of expressive arts therapies, but I think it's something that still the general public just doesn't really know a lot about or understand how doing this weird thing is therapy and going to be transformative. And so so tell us about drama therapy and what makes it great, and especially how is it healing for people?
Sure. So to give people a little gist is that we think of therapy as talking, right? You go in an office and you talk. It's like, oh, this thing happened that was so stressful this week. I had a fight with so-and-so. It's not that that's not valid, but the creative arts therapies have a little extra something to provide there. So it's not just talking about problems. It's doing things that make it actually to open the doorway to even talk. Sometimes it's hard to talk, right? Sometimes we get teary when we talk, or we just get angry and those emotions overwhelm us. And if we do an activity that's experiential, as you're saying, we sort of feel more comfortable to even get the talking going. So it's both. And I guess that's one thing I'd like to emphasize is that the creative arts therapies are very similar to talk therapies in a lot of ways. All of us are trained very similarly in our backgrounds. Those of us who do get master's degrees in the creative arts therapies, we are more akin to counseling than social work in terms of we do sort of the traditional counseling courses. We do group dynamics and abnormal psych and developmental psych and all these things that a traditional therapist would also get. So we are actually trained to do both the talking and the non-talking. So we might vary that up during sessions. So some people ask me as a drama therapist, hey, well, every time I meet with you, will we do drama every session and the whole session? No, not necessarily. Some sessions it's just talking, or some sessions it's a little snippet of drama here and there. And it also can be subtle with the creative arts. It doesn't have to be like you're up and acting and you're in a costume. That's actually typically not what happens. But sometimes it's more subtle, just to do some role reversing in the moment. To give an example, if I have a client who talks about shame sometimes, like, oh, I'm beating myself up over this thing I did. I just can't believe I did that thing. I'm such an idiot. I might say, okay, I'm going to be you for a moment. I'm going to repeat what you said. Who's somebody in your life who you're close with, and what might they say? So you're going to take that role. And of course, when people actually step back and take a role of a loved one, they see themselves very compassionately as opposed to critically. So it's little subtle moments like that that it can be drama. So yeah, so we do mix the talking and the non-talking. So in terms of drama therapy specific, what it is using theater processes intentionally for therapeutic purposes. So storytelling, role play, mask making, puppetry, different things that we would consider drama techniques are going to be used in the sessions for therapeutic purposes. So there's a couple of theories that are important that I like to throw out there when I talk about drama therapy. So one is roles. So one of the theories we see, and this actually comes from social psychology, that people are in role, right? So right now my role is very different than when I'm in role with my husband, or when I'm in role with a friend, or when I'm with my parents, right? So my roles change up depending where I am. And prior jobs I had, I was an employee. Thank goodness I'm my own boss now, so I don't have to have that role anymore. But you see, we change roles all the time, and we have to be flexible within those roles, or else we're not going to function very well in life. So the sort of takeaway from this is, one, yes, we all have multiple roles, and that we have to be comfortable playing them. And the larger this so-called role repertoire is, the more healthy an individual is thought to be. So if somebody gets stuck in certain roles, like we have people who do get stuck in the victim role, or people who get stuck in angry person role, or some people get stuck in the nurturer role. That's a common one that, especially for trauma, I see a lot of people who are people pleasers, who are caregivers, so they get stuck in that role. And so that's something we can explore, is how to vary up the roles a little bit more. So that's one aspect of health in the drama therapy lens. Another thing that has to do with those roles is the idea that it's also good to be comfortable with sort of ambiguous roles, meaning feeling comfortable to be both the child and the adult simultaneously, or being able to say, hey, there's sometimes I feel like a sinner, there's sometimes I feel like a saint, or a beauty and a beast. So being able to just say, I can hold those roles simultaneously. That doesn't make me weird or bad, right? It just makes me whole, that I can be all these things.
So what that brings to mind for me is that I do a lot of parts work.
Yes.
With clients, and this sounds like a really yummy, engaged way for people to work with internal parts of self, and to be able to develop that flexibility of sort of moving from black and white thinking that, we're all this way or all that way, and be able to come into relationship with these different parts of self. And for anyone watching who's not sure what parts of self are referring to, is that we actually refer to this in common language all the time. When we say, part of me wants to go to the store right now, but part of me wants to stay home and watch TV, or part of me wants to, go to school, but part of me wants to stay in the job that I'm in. And so we use the language of parts all the time. But what's interesting is that when we bring that up in the therapy setting, I find that people sometimes are a little freaked out, right, by this idea, especially as they start to connect with, sort of consciously becoming aware of different parts of self. And like you were saying, one being a child and one being an adult, and starting to recognize that, different parts of us have different agendas and different ways of being. And so I can really see how using drama principles and activities provide a wonderful way for us to start to connect with parts and learn about who they are.
Yeah.
So I'm wondering, are there, what are some of the sort of experiences or exercises that you invite clients into around sort of getting to know their different ways of being?
Sure. So yeah, so that's where the experiential part comes in, right? It's like, yes, we could talk about our parts and we could talk about sort of the things that make up those parts, but I like to take it into that creative realm. So we might make a mask for each part. That might be something to sort of put it in a more concrete terms, what it looks like, what it feels like. We might do puppetry with it. We might do sand tray with it. You know, having a client pick a figurine out of my collection that they feel represents that part. So there's different ways to sort of creatively explore that. And even just physically sculpting the parts, if that makes sense. Like take the pose that this part would play. So there's lots of ways to sort of embody it and bring it to a concrete. That's the thing I love about the creative arts therapies is this idea of concretizing things that are mental otherwise.
Yeah.
Right? Because when we talk about all these concepts, they're just in our brain. But with the creative arts, we can bring them out and actually look at them. There's this idea in drama therapy and the other creative arts where you can externalize it, right? You take this thing that's internal, bring it outside of you. That allows you to see it more objectively, because it's in front of you, if that makes sense. And then what happens is you can play with it and reintegrate it in a healthier way.
Yeah. So talk a little bit about, you know, if somebody comes in and they're doing this type of therapy, right, and they make a mask or they, you know, do puppetry or sand tray, and we can talk in a minute about what that is. But what is transformational? You know, if I come to your office and we do that, when I leave, what potentially have I done or experienced as a result of the process of making that mask or doing that puppetry? Why is that therapeutic or transformational potentially?
So to give you a couple examples in very like brief terms, just to, you know, maintain the confidentiality of clients. So one of the things I train a lot in drama therapy, one of the cases I talk about that illustrates this is like a lot of us creative arts therapists will do this inside self and outside self that you show the world. So it's not just unique to me, but it is a technique I use. And so this teenager I had been working with who had been sexually abused, very closed off kid, very shameful, but wasn't the type to really say that. She didn't talk a whole lot. And I decided, okay, so let's do some of these experientials because talking's not really going anywhere anyway. So I asked her to do, what's the self that you show the world? What's the self that you are hiding? And just gave her these masks to create. And the outer one, she had it all rainbows and hearts and butterflies, and it was sparkly and beautiful. You know, it was very pleasant. And then this inner self was gray and red, and I think there was some orange and some yellow in there as well. The flames engulfing her mouth, like literally like a hand, like, you know, almost, but the flames engulfing her mouth, and her eyes were like just black. Yeah. And so this obviously was a little bit of a breakthrough for somebody who, everything's okay, I'm doing great, I don't know why I'm in therapy. So sure enough, when we started to play with that mask and to talk about what I often do with clients, a part of drama that I'll do is monologues, where, okay, so you're this role, give me a little snippet, a little paragraph about what it's like to be in this role. I might give prompts like, when does this role come out? What makes this role feel good? What makes this role feel bad? What does it have a purpose for you? Because I believe, personally, every role has a purpose, good and bad. But yeah, so to poke a little bit for people to think about what's behind these roles, right? And so for her, she was like, yeah, there's a lot I'm not telling people and that I feel consumed by, that I'm holding it secret. And then she broke down and she actually, for the first time, was like, I'm willing to tell you my story about the abuse. Can you please turn your back because I don't want you to look at me? Yeah. You know, but it was a breakthrough. It was like, wow. So actually to explore through these masks got somewhere that just talking hadn't gotten. Another example I could think of, to talk a little bit about sand tray again. And so for people who are watching not super familiar with sand tray, it's literally a box of sand. Mine is pretty small. Some therapists who have specialized in it or who do play therapy specifically a lot, they'll have big ones, like coffee table sized ones. I love them, but I don't have, I don't have room in my office to have something that big as much as I'd love it. So mine is relatively small. I tell people, you know, you could if you're a therapist interested in doing that, you can have a little small one. Just go to the store, get some Tupperware that's wide enough, and get some sand and collect some figurines and have a variety of different things to choose from. So I'll ask my clients a lot of times to sort of recall things in the sand. So maybe it's a nightmare that they want to act out, and then I'll have them just change the ending so that they feel empowered instead of sort of taken by that nightmare. So one of the things I do, it's similar to the vision board workshops I do, where I'll say, let's look at where you want to be and how to get there, and maybe pick some figurines that represent your obstacles on your way there. And I was doing that with a client, and she picked figurines that represented her obstacles. And we also in that process picked figurines that represent who are the resources, or what are the resources to use to battle those obstacles as you get to them, to get to that goal. And so she was a client who had a lot of clarity about what her goal was, but not how to get there, if that makes sense. So when we got to, okay, so now you step into that future role, I want you to feel what it's like to be where you actually want to be. And she chose a lion, and she was like, wow, that's so empowering to like literally act out. At that point, we moved from the figurines. I said, I want you to feel this, like you and your body, you stand here, you are future you are this lion. So then she said to me, I don't think I could take that power on yet. And so I suggested, okay, well, you know what? Can we try a baby lion? Can we take a little step towards it?
Oh, I love that.
Like, I can do that. I can do baby lion. So she became a baby lion, and she teared up, and she was like, oh my gosh, the power I feel stepping into that role.
Yeah.
So that's just a little snippet of how this could work in a way that talking just doesn't get to.
Yeah. So this is what I love. What you just described is what I love about the magic of experiential therapy. And that is because what a lot of people sort of aren't thinking about is that we have our thinking selves and we have our experiencing selves. And in traditional talk therapy, we often come in and we're talking through our thinking selves. But it's our experiencing selves that are experiencing distress, that are bringing us to therapy. And so if we're not doing therapy through our experiencing self, then we can talk about what's going on and why and what happened when we were 5 and how it's affecting what's happening now. But if nothing is sort of touching that experiencing self, then it's hard to have a transformational experience in therapy. And what you're just describing is, somebody contacting that experiential self and connections being made. And so, the brain wants to move towards integration, towards wholeness, towards balance. And so much of our efforts, as you know, are about trying to survive by separating, by isolating things about us, parts of ourselves that we feel like, like your one client, her outside self versus her inside self, and that for so many of us, we think, okay, well, I've got to hide all of this. But what integration is and what wholeness is and what balance is it all coming together, and in a way that isn't what people are often afraid of, which is everything's going to fall apart and I'm going to be completely rejected. But instead what happens is wholeness. And so, the things that you're doing, these drama interventions are allowing that experiencing self to make those connections and to find little pieces of wholeness in safe ways. And that's what you did, inviting that client to be that baby lion, right? Instead of the big one. Other parts were not ready, didn't feel safe to be that big one, right?
Yeah.
And And so that's the magic. As a therapist, when I have those moments, I feel like, like this is my superpower that I can facilitate this.
Yeah. Yeah. And if I may get geeky about the brain.
Yes, we are here to get geeky, so bring it. Yes.
So I always tell my clients, like, one of the things I also do as a therapist, aside from this fun creative stuff, is I am all about education, because I like to normalize for people.
Yes.
And this, personally, this helps me when I'll read something and go, that's why my brain works the way it does.
Right.
So to stop a moment on what you're saying, right, is that we have three parts of the brain. We have the brain stem, the bottom part that develops first when we're babies. And that part is for toileting and eating and drinking and all our basic functions. We have the limbic system, which is the emotional brain, which is more midbrain. And so that is where our emotions are, and our anxiety is for a reason, right? And so when I talk about parts having a purpose, so do our emotions. And so anxiety, its purpose is to protect us, but sometimes it goes a little crazy, seeing threat where there's not threat, right? And that's where it becomes problematic. And then we have the third part of the brain is the uppermost, and it doesn't really develop until we're young adults, which is actually why teens are notorious for bad decisions. And people who have ADHD and executive functioning stuff happening, that's because that thinking brain is not, it's not its best.
It's not linked up. It's not linked up to everything.
Right. And so what's important about this is when we are in our emotions, when we are anxious or depressed or anything that's high in our emotions, we get stuck in the emotional brain. It's science. It's like we can't access the thinking brain. It's like different parts of a computer having different windows open. You can't access it when you're like focused in that emotional one. And so this is important in terms of why I defend or support, or whatever you want to call it, with the creative arts therapies, is what we know is that you can't talk through certain things when you're high in the emotions. This is where cognitive behavioral therapy, in my opinion, and a lot of people fails, right? Because it's great in theory. If you're in your thinking brain, if you're calm and you're able to rationalize, great, you could do that stuff. You could challenge thoughts and stuff like that. But when you're emotional, like someone who's having a panic attack, you can't like be in rational brain. You just cannot. So this is important because why in therapy the creative arts work is we're accessing sort of the different parts of the brain. We're sort of using the whole brain more so, because there is some problem solving, different things that might happen, right? If I say, okay, so take on a role and think of something from this role, it's sort of touching on that cognitive piece of it. But it is actually that experiential part you're talking about. That's what it is you're getting into the body, you're getting into a more holistic approach rather than just the cognitive thinking part. So it's reaching that. And also, I have to say, as a trauma therapist, that's part of it as well, right? Is trauma gets stuck more so in that emotional brain. Trauma also gets stuck more so in the right hemisphere of the brain, which is where we have more artsy parts of us, right? It's more sight-based in different things. Like the way that trauma affects the brain is language gets shut off. That's why some people don't have words for trauma. And trauma doesn't tend to be a linear story. It might be scenes or smells or sensory experiences. So the creative arts help access those parts that get cut off during trauma. And so, yes, between the emotional part and the trauma part, I just think the creative arts therapies and other experiential therapies are so much better than just talk-based, just rational-based therapies.
Yeah, and I'm so happy that what you just said, because I feel really strongly about education as well, which is why I'm starting to do these videos. I think most people don't, even in the mental health field, don't realize that there is a transformation happening in mental health because of what we are coming to understand about the brain and the way that we as human beings process and encode information. And I think that, with cognitive behavioral therapy, just, traditional talk therapy being the standard that we're all trained in graduate school, I think that what ends up happening for many people is they go to therapy and they talk and they get some coping tools, right? But what people really want when they go to therapy is not to learn how to manage their anxiety better. They want to resolve their anxiety. They want to not be anxious. And and so I think for many people, they may leave their therapy experience where, you know, they've been in a cognitive behavioral or psychodynamic focused therapy experience where they feel like either A, therapy doesn't work, or B, there's something so broken in them that therapy doesn't work for them.
Yes.
And the message that I feel like those of us who have been fortunate enough to, you know, for our paths to take us into these experiential modalities, that we have got to share with people that it isn't that therapy doesn't work, and it isn't that it doesn't work for you. It's that to be truly therapeutic, therapy has to access the different parts of the brain. And the thinking brain is one part that we want to engage, definitely, right?
Yeah.
But if we're not contacting and working with our experiencing self, right? So emotion in the moment, felt sense in the moment, sensory information in the moment, then we can manage anxiety, but we're not going to resolve the core driver of anxiety. And so, you know, so that's one of the reasons I wanted us to get on and talk, because I just think that you know, people need to know how their brains and bodies work. And many of us are in a position to share that knowledge and that information. And so along those lines, I'm wondering if there was something that you wish that clients knew coming in about how to really use their experience with you to get that transformation. Because the other piece is that the work really is the clients. Like, we can facilitate, right? We can facilitate and we can invite them into experiences, but you know, the individual, we as individuals, if we're clients, we have to show up with some readiness, some degree of openness to engagement, to contacting that experiencing self. And so, so I'm wondering what you would, you know, kind of educate people about how to think about using therapy well, especially drama therapy.
Good question. So I'm not sure if this relates or not, or how it does. I was thinking about when I do train about trauma and drama therapy. So for those of us who are trauma informed, we sort of know through a lot of sources nowadays that one of the first things you do is safety and grounding and coping skills. And the way I explain it to my clients is like, that's where all of us are going to start, because I really believe we all need to have that solid foundation. When you think of building a house, you're not going to build on unstable foundation.
Right.
So having that sense of safety and just having our resources to pull on as we do the actual trauma stuff, like, that's the interesting thing about being a trauma-based therapist too, is you often get you know, people who are like, okay, we're going to delve right into the trauma. And I think those of us who do this well, no, we're going to take a lot of time if we have to, usually, to build those resources so that when we do get to the processing of the trauma, we have resources to pull on when someone gets overwhelmed.
Yeah. So talk a little bit about why we who work with trauma really feel it's important. Like, we'll even stop a client who's starting to tell their story in, you know, the first couple of sessions. But talk a little bit about why, even if that's what you're coming to therapy for, right? We don't want to jump into sort of ripping open, right, that box early in the therapy experience, which I also think many people have experienced and then felt hurt by their therapy experience. So talk a little bit about why we don't do that.
It's overwhelming. It's flooding. It's and there's so much I want to say. Go back to the brain for a moment. So we have fight, flight, or freeze. We sort of know as these big responses we have in terms of our survival states, that what our body is attempting to do in moments of fear is protect us. And so we do that by either fighting something scary, fleeing from it, or freezing because we just feel so overwhelmed. And so what happens with sort of an upsetting experience, including trauma, is that we have one of those responses. We might get so activated, we're anxious and everything. Oh, what's that noise? Oh, we're on hypervigilance there. Or we freeze, and that's when we see people who dissociate and zone out, and you call their name, they still don't answer, kind of thing, right? So we can go to those extremes, and it's all meant to do the same thing, which is protect us, essentially. And so if we go to the trauma processing too quickly, people are just going to get flooded or shut down, and you can't do the work. So you sort of have to be in that middle ground. And we do have that word window of tolerance term, I should say, but we have that for a reason, right? Is that people are in that sort of space where they could be emotional, but not overwhelmed by it, right? Yeah. We need that sweet spot. And so we need to do a lot of work to get there, to stay in that spot, right? And that even then, even after doing a lot of that work, is that people still are going to get overwhelmed or have the tendency to shut down. We have to be able to tell them how to come out of it, and how to either calm down or get back to being able to be open with the emotions. So that's sort of the process, is being stable enough to notice when that flooding happens or that shutting down happens, and knowing how to come out of it. And one of the things I was going to say too with the brain stuff, and one of the things that I'm really in like the past year, I'd say really geeking on, is the vagus nerve. I love the vagus nerve.
Yeah.
And that's a newer concept. That's not something I was ever taught in grad school or anything. I mean, that's something I came to through reading myself. And
yeah. So talk a little bit about the function of the vagus nerve, and what we're coming to understand about its relevance and importance for mental health.
So it relates to what I just said about the fight, flight, or freeze response, right? So the vagus nerve is the largest nerve in our body. It goes from our brainstem down to our bowels, and it's this huge, thick bundle of nerves. It's not even just a single nerve, from what I understand, but it is responsible for a lot of things. So it's something that is both physical and emotional, meaning it has its sort of physical purposes, but it also ties into our emotions. And so what happens is it can be activated in a way that's positive and activated in a way that's negative, meaning when it's activated in a negative way, it gets too activated. And that's when we see that hypervigilance. And that's when people get into that fight or flight, or that what we call mobilization response, right? And so when it gets shut down, we tend to get shut down either when we feel we're helpless in a situation. Like, for example, if someone's attacked and they can't fight or flee, and they go into shutdown then, or when we're rejected. And it's really interesting, because when you think about our role as social creatures, and this is something else I emphasize to clients, is we really are social creatures. Evolution has made us this way, that we need tribes. We needed, back in the day, you needed a whole group of people to survive. You couldn't fight off all the crazy wild creatures out there and whatnot. So nowadays, we still have that innate drive to be around people, to belong, to feel loved. So that's not weird that people want that. It makes perfect sense that that's a survival thing, that we do better when we're in groups. And so when we feel rejected, we feel like we can't survive. It's really weird. Our brain doesn't know the difference between, oh, that fire is going to hurt me versus that rejection is going to hurt me. And that's why we feel it so intensely.
Yeah, it's so funny. At my house, we've been watching Blue Planet and some of the other, recent nature shows that are incredible, right? The footage that they've gotten is incredible. But having this understanding of the sort of core survival responses that we have as mammals, and it's easy for us to forget that we are animals, right? And that much of our brain is dedicated to those processes that are common amongst humans and all mammals, and that we are not that different, that we have these higher cognitive functions, and we've created a way of life that is very cut off from nature. But when I watch these shows through this lens, what I see are the exact same behaviors, right, in these animal populations when they are threatened, but also the relationship seeking, right, and the types of connections that they have, and the way that they pursue safety versus when they feel threatened. And it's no different. We are no different. And And so when we can understand that, and that's, something I also really try to drive home to my clients, is that when we understand these fundamental aspects of our nature, and that's the experiencing self, our mammalian and reptilian brains, that's where our experiencing self is happening. And when we can understand that, then we can engage those higher cognitive functions to help to regulate, to help to integrate that experiencing self, to allow, to create or facilitate the brain being able to do what it wants to do, which is heal disintegration, right, from trauma, to heal those symptoms and allow sort of regulation to happen. But, you're absolutely right. When I don't have a single person in my whole experience, and I think we're all like this, that fundamentally what we as humans fear is rejection by the herd. I'm going to be found to be not enough, right? I'm going to lose my job and my family, right? When we follow that whole fear story, right? It all comes down to, I'm going to be ejected from the herd in one way or another because I'm not enough. And so, when we can bring that felt sense fear into awareness, right? That's when then we're able to, again, engage those higher cognitive functions to say, oh, okay, yeah, this is what's going on. This is why I feel this way. And I don't have to do the thing that fear is telling me to do, right? I can help to regulate my body and my emotions, and then I can go do this other thing that is going to be healthier or have a better outcome for me, right? That are animal mammal cousins, right, don't have the capacity to do necessarily. But so I love everything that you're saying. So if
I may bring it back to sort of the drama therapy piece, and how when people come to me for therapy, sort of my process. So this vagus nerve, right, is that we want to activate it for the positive, meaning that it's like calm. So here's another part of this whole science thing to know is, right, we have the sympathetic nervous system and the parasympathetic. Mm-hmm. And the sympathetic is what gets us activated, right? And the parasympathetic is what we call the rest and digest, the calm. So when we do things like deep breathing, when we sing, when we dance, when we get that body moving, especially that vagus nerve area, meaning like our torso essentially moving, that's when we activate it for the positive, right? So this is interesting because, again, talking is not going to activate the vagus nerve.
Right.
Talking alone is not going to do it. So what we know is, in terms of calming down that fight, flight, or freeze stuff, we need to do physical things. So this is why people like you and I, who are focused on the somatic-based stuff, why this is so important, right? And so what I emphasize to my clients when they sort of come to me is, yes, we're going to start with coping skills and grounding and all this stuff that's going to make them feel safer. And also I emphasize, like, we need to really focus on how to actually physically get them out of that anxiety and depression. Yeah. Not just talking stuff. And yeah, sometimes I'll do CBT type stuff down the line when they are, like you said, when they're able to, oh, okay, I'm recognizing that my fear response is on. Now that I recognize that, it doesn't have a hold over me. And now I can think rationally, right? So it's like, you've got to teach people how to do things like deep breathing and whatever is going to help them, listening to music or anything that's going to activate that vagus nerve. I had a client tell me the other day, like, when I mow the lawn, the vibrations really help me feel calm. And I was like, I bet you're activating your vagus nerve. He was like, yeah. It was funny because I give them that language. Like, I'm always giving them this education. So I think that's where I sort of start. That's where I sort of tell people they'll get the most out of therapies if they're willing to go down that route with me, right?
Yeah. So I was just sort of thinking about, if somebody identified as, having a background with trauma, and they were, thinking about, doing drama therapy as a form of treatment. I would imagine that a question someone would have is, ultimately, am I going to be reenacting or acting out my trauma
Great question.
experience in
Great
therapy?
question. No.
Yeah.
So that is a common question. And again, being a good therapist is knowing sort of, so two terms we use in drama therapy is underdistanced and overdistanced, meaning a client is underdistanced when they're too far from their emotions, right? They're like very rational and cerebral, and they can tell their story of their trauma without any actual emotion involved. And overdistant, or what, actually, that's overdistance. Underdistance is when I don't have enough space for my emotions. I'm overwhelmed and right? So a good therapist in general, even without knowing those terms, we all sort of know how to work with our clients in those, right? Is that we understand how to try and bring someone closer to emotion if they are telling us, oh no, I don't have feelings about that really. So we do some investigating. And if they're over emotional, we know how to sort of calm them down, right? And so drama therapy is no different, and it's just a unique way of looking at it, where we have things like we have psychodramatic techniques, we have projective techniques. So to give you a little idea of what that is, psychodramatic techniques are the me roles, where it's role reversing. Like I may be like, this is your future self, this is your past self. That's still you, right? And you playing with those roles is still you. Or there's a technique that developed out of psychodrama, which came a little bit before drama therapy, but they're very similar. That is called mirroring, meaning maybe if somebody's acting something out, you pull them out of it. Especially in group therapy, you might say, okay, someone else is going to play you for a moment. You're going to watch how you just did it. Or in individual therapy, I might say, I'm going to be you for a minute. Watch how you just played that. So it's them, but it's still playing with role. See?
Yeah.
So still a me role, but that's psychodramatic techniques. So if somebody were removed from their emotions, you might use one of those techniques to get them closer to it, right? On the other hand, the projective techniques are removing from those roles. So meaning if somebody is having trouble with their mother, and it might be too intense to be like, let's role reverse with you and your mother. We're going to do a scene where I'm your mom and you're you, and we're going to let you test out that. That's a little too intense, right? It's like if there's a lot of emotion around that, that might bring on the flood works and we can't do anything because, again, they're going to get out of that window of tolerance we just talked about. So in that case, it might be like, okay, well, let's do a story about a mom and a daughter. And we might make up a story to examine a mother and a daughter's relationship. And then might say to the client, so how do you think you might be like that character in that story? So it takes the intensity out of it, right? Because it's removed a little bit.
Yeah.
And so that's how drama therapy largely works, is playing with bringing someone closer or further from their emotions to get them in or out of that window of tolerance. And all the creative arts therapies sort of have their techniques around that. Like in art therapy, I'm aware that finger painting is really regressed, meaning you don't give finger painting to somebody who is emotional and all over the place, because it's not very much containment is the word we would use for that, right? They need like a piece of paper that has a frame that they know they can only go on that paper, and like really controlled stuff, right? Because they need to have some containment. Whereas if you want somebody who's super cerebral to open up, you might give them finger paint. So it's like, yeah, it's a really interesting way of seeing it compared to talk therapy, if that makes sense.
Yeah.
So that leads back to your question in terms of, I, as somebody who knows that trauma is emotional, I'm not going to be like, well, let's just flood you by reenacting your trauma. Right?
Yeah.
So there's different techniques we'll use to deal with trauma that will still allow for the healing without going to that. So to give you some examples, I might say, let's tell the story of what happened to you from a different point of view. So maybe you're the lamp in the room that watched you get abused by your uncle, So then it's like, okay, so what does the lamp say about it?
Yeah.
Right? And that gives it a neutral tone rather than this happened to me. The lamp is observing it, right? So that removes it to make it safer. Or kind of like I said about the sand tray and changing up nightmare endings. Sometimes you might say, okay, so I already know what happened in your trauma story. Let's change the ending, right? What would you have wanted to happen? You wanted to have power over that abuser? Okay, go ahead, bury him in the sand, throw him in jail, whatever it is, you need that ending to be different. Let's change that, right? So it's things like that happen for the healing.
Okay. Beautiful. Yeah, great. Well, thank you so much. This has been really fun. And so if people wanted to find you either as clients or as therapists who are, interested in learning more about drama therapy, where can people find you?
My website is my name, so you have to remember. So it's KristaVerrastro.com, and I will spell it for people. It is KristaVerrastro.com. That's the best way to find my information. I do have a blog on there, and I do try to really make it geared towards drama therapy most of the time. So there's some fun stuff there that gives ideas about sort of how to have this lens. People, if people want to be in touch with me about my professional trainings in drama therapy and trauma work, they could reach out to me through that site, and I could certainly put them on. I have an email list for both professional people, and then I have one that is more general for people to get my blog, so people can be in touch with me and I can put them in the appropriate place. Great.
And do you have any vision board workshops coming up?
I don't at the moment. I imagine that fall will be when I will start having them again. It tends to be winter because of New Year's, then it's spring because the rebirth theme, and then fall is usually because the time of change. So probably, yeah. Okay. Can people get on a mailing list by going to your website for vision board workshops? Yeah, so the on my blogs page, there's a subscription box, and that subscription is for really my blogs and the public events I do. And again, if anybody's watching this who is a professional therapist like us and they want to be more so in the professional world of things, I do run a separate list for that. And that has, sometimes I'll do like you attended the vision board workshops for professionals only. So again, people can reach out to me and I'll get them in the proper place if they're concerned about what list to be on. Yeah, great. Well, thank you so much. This was really fun, and lots of yummy information about drama therapy and just experiential therapy in general that I think is so important for people to be able to learn about. So well, thank you. Thanks for having me. Absolutely. Again, I'm Karen Helfrich with Avalon Psychotherapy Associates, and I will see you next time. Thanks.